Okay, so next we have everything we need to draw up and inject HCG. So the first thing we have is a 10 ml syringe attached to a 22 gauge needle. We call this the mixing needle, and it actually says mixing needle on the instruction. And then we have our insulin syringe, which we use to inject. That comes in a bag like this with 10 syringes in there. We have our bacteriostatic water, our HCG, and then we always need alcohol pads to sterilize everything. So first step is going to be to take the tops off of these two bottles, and we're going to sterilize both with the alcohol pad. So go ahead and rub the top of the bottle there, and then rub the other one, and that makes it sterile. So first thing we're going to do is take the mixing syringe and needle that are 10 cc's, they're kind of large. We're going to pull that cap off, and we are going to plunge this into the bacteriostatic water, and we always do it upside down like this. We will draw up 5 mLs in this instance of water into this syringe. And then we'll push the air out. And so right there I'm at 5. And I know I'm at 5 because the very, very end of this black plunger, which is this top line here, is at 5. We don't want to use this bottom line. So we have 5 mLs in there. And the reason that I know that I need 5 is because the box will say that on there. This one here says mix with 5 mLs of diluent, which is the water, and inject into the this HCG bottle here. So here's our HCG. It's a powder, and so what we're going to do is we're going to insert the needle containing the water, and it's vacuum sealed, so I don't even have to push down on this syringe to get the water to go in. It will just automatically go in. And then what I recommend doing here is there's still a vacuum here, which will prevent you from being able to draw up any of the liquid that's in here because it's a vacuum. So we want to release that vacuum. So what I do is I pinch the end of the needle here, hold on to it, and then just unscrew, and that will allow air to rush in and equalize the pressure. Then you can just go ahead and pull that off, and your HCG is now mixed. And you shouldn't really have to shake it or anything. All that white powder is now gone and it's ready to go. So in this instance, we're saying to inject 500 IU. And the way we know 500 on here, which is the most common dosage, is we draw this up to 50 on this type of syringe. So we pull the orange stopper off, and we're also going to pull this stopper off and aim for the center of the vial here where that little bullseye is, push that in, turn the whole thing upside down, and then we're going to start drawing in the fluid until we get to 50. Oops. And it's okay if it slips out, you can just put it back in and then just keep drawing. And it's a slow process because that's a very tiny needle, just be patient. And so I'm drawing a little bit past 50, and then I'm going to push all that air out until I get to 50. So that should be, yep. So we're at 50. Go ahead and pull that out, and then you can put the cap back on until you inject. And that's how you draw up HCG.